Hey,
Hi.
how are you?
Good. Just trying to make sure my camera's not gonna fall over.
Same. I was like, oh, this has to be on my phone. Uh-oh.
Yeah. Um, we'll give folks a bit of time to join, and then we'll jump in.
Sounds good. Sorry, I'm still in scrubs. I didn't have time to change.
No, I think it's perfectly fitting for the conversation today.
Perfect.
Yeah. Is this your first time doing the Instagram live? Oh, this
It
is
is.
good.
Mm-hmm.
Good. Hey, Lando. I see some of our other influencers joining.
Hey.
So let's just get started a little bit. So today's session is going to be all about answering questions regarding COVID-19. So while these times can be stressful, I just want you all to know that it is extremely important to remain informed about COVID-19 and to get that information from a reliable resource. So we will talk about COVID-19 today with two of our providers. First up is Dr. Lane, who you see on the screen, and then Dr. Pumphrey, who will join us later. Dr. Lane specializes in medical health, and Dr. Pumphrey specializes in behavioral health. So I encourage everyone who's tuning in to ask questions in the comments so that we can be sure to answer them in real time while we're here on live. So I'll introduce myself, David Wilson. I am a social media influencer with Whitman-Walker Health. My pronouns are he, him, his. And I mean, I love being a part of the Whitman-Walker team. It's been a great 9, 10 months that I've been doing this. Dr. Lane, would you like to introduce yourself?
Sure. So my name's Dr. Colleen Lane. I am a physician. So I'm trained in internal medicine and pediatrics. I'm the site director at our medical site in Anacostia. So I work mostly in Ward 7 and 8. I do spend some time on 14th Street also, so I kind of am all over at both of our sites. My pronouns are she, hers. I have been working, doing kind of the coronavirus testing, planning, working with patients since Whitman-Walker started. And I went back and looked. It looks like March 13th is when we really kind of jumped with both feet first. So it's been
Yeah. Absolutely. And so, the last time we spoke about, COVID-19 in this respect, we had just began the shutdown. And, I remember communicating to the viewers that we believe that masks didn't help and we did not know how long this pandemic would last. So a lot has obviously changed since then. Can you tell us what we have learned about COVID-19 since March?
Yeah, you're right. We have learned a lot. And I think it's really interesting because the scientific process is really being played out in real time. So in March, February, March, we didn't know much about this virus. So things were kind of happening quickly. We were making kind of our best assumptions and best guesses, but we have learned a lot over the last 6 months, which has allowed us to really put a lot more tools in our toolkit on viral mitigation or preventing spread. And what we know now is completely opposite of what we're
Yeah.
that masks really work. So in March, we were concerned about a shortage of masks, especially for healthcare workers. And what we thought was, maybe there was the greatest risk of spread when someone was really, really sick. So when somebody was in a hospital setting, coughing a lot, creating a big cloud of virus around them. So we felt it was really important to make sure we had masks for the hospital setting. So that setting,
Right.
really the priority and kind of the focus in March. What we know now is people can walk around and not have symptoms or very mild symptoms
Yep.
and spreading virus and kind of a cloud of virus around them. We think probably if you are sicker, you have more of what's called a viral load, so more active virus, so it's easier to spread. But
Okay.
no, asymptomatic people also can spread virus without knowing. So we've actually now have studies to back up the fact that if I'm wearing a mask, everyone around me is wearing a mask. We also are distant, so maintaining that, at least 6 feet distance apart and not spending close time together. So really
Mhm.
minutes in the same confined space together, that dramatically lowers the risk of
Yeah.
spreading, getting the virus.
Yeah. So you mentioned some of those precautions that, we should be taking. Social distancing is one of that. Should we continue that? Or are there any other precautions we should be considering?
Yeah, so social distancing, definitely. It's probably hard to follow now that we're 6 months in and people miss each other and it's getting colder outside. Not as exciting to eat outside, with friends, but
Yeah.
distance is really still extremely important. So what we've seen in some settings where we've gone back and looked about how the virus has been spread, it's been spread in settings where people are in close quarters. So like, for
Mhm.
example, hairdresser. So there's kind of a famous study of a hairdresser and their colleague who both didn't know, but they had COVID-19 and were spending time with clients. And when they were with clients, they had masks on, their clients had masks on, and no one got sick. So there was no
Oh,
spread.
wow.
But when the workers kind of relaxed, took their masks off, and went to the break room together, that's how it got spread. So
Uh,
no, it's when we kind of get relaxed and we kind of get, complacent with some of these rules, that's where this kind of we call community spread, can start to happen. So it is frustrating, but it is still very, very important. Social distancing, wearing masks, hand washing, and I'll also plug for staying home when you're sick.
Absolutely. And so I remember the conversation getting started about social distancing, and the idea behind that was that we wanted to flatten the curve.
Yep.
So have we flattened the curve? Are case numbers still going up? Are they going down? What targets, or are we reaching those targets that we discussed?
Yeah, so, it depends on where you're looking and what part of the country you're looking in. So in our area, we have to look at the whole DMV area. So DC, Maryland, and Northern Virginia. And looking back in March, April, May, kind of early summer, we, in comparison, have definitely flattened the curve, meaning the percentage of overall tests that we're doing that come back positive is much, much lower. So we're kind of hovering somewhere between 3 to 7%. So kind of in a low average, but still not sustained under 3%, which is what we want to see when we say, okay, community spread is at a low risk. So the curve has come down, but we're kind of stagnant at this low risk level, which is why DC at least hasn't moved to phase 3. DC has some interesting markers though for moving to phase 3. The mayor actually just updated this, I think, a week or two ago.
Okay.
Some of the things that she also wants to see, in addition to low levels of test positivity, so that less than 3%, she also is really looking for things like community engagement,
Hmm.
specifically working with contact tracers. So,
Okay.
yeah, when somebody tests positive, sometimes a contact tracer can get to that person and call them even before I get a chance to call with the test.
Yeah.
And so we're only seeing about maybe 70% of people interacting with the contact tracer, kind of giving
Okay.
about where they've been, who they've been around, those contact tracers, and then go out and tell people to quarantine. The mayor really wants that number to be like above 80, somewhere close to 90%.
Yeah. It's interesting that you say that because I've actually, I've gone and sat outdoors at a restaurant, and I noticed that, some restaurants are being more responsible than others, obviously. But I have noticed that people are starting to ask you to sign a sheet and for the entire party, and so those type of things are happening to help with contact tracing. It's actually really good to see
Yes.
that happening in DC. So it's good. It's good to hear that. We haven't quite flattened the curve yet, but it's definitely gone down.
We're
I want. I'm sorry, I didn't hear you.
heading in the right direction.
Yeah, absolutely. So that's good. I just want to remind people who are watching that if you have questions, you can put them in the comments and we'll address them. So my last social media post like this was actually about the flu vaccine because obviously flu season is approaching us, and so with flu season around the corner, how important is it to get the flu vaccine? You know,
Yes.
can and also is there any way to differentiate between, COVID-19 and the flu?
Yeah, that's a great question. Getting the flu vaccine is going to be extremely important this year. I got mine today. So
Okay, good.
the problem is, we think, again, we don't have ample evidence, but logically, and what most scientists and medical people are thinking, is if you get co-infected, meaning you get the flu and then you happen to also get COVID-19 on top of it, it's kind of a double hit to your body's immune system, especially
Wow.
for people who have pre-existing conditions, so some type of lung disease, diabetes, other diseases that make their immune system not work as well. Fighting
Mhm.
viruses, that can be potentially deadly.
Yeah.
So can prevent the flu. We have flu vaccine that's safe, that works, and that is already available. So that is a very, very good idea. The,
Absolutely.
the question about differentiating COVID-19 and the flu, that's
Yeah.
great. So those symptoms overlap a lot.
Okay.
Unfortunately,
Yeah.
the classic symptoms of flu, cough, fever, shortness of breath, are some of the classic symptoms of COVID also. Now, there are some subtle differences. Sometimes COVID can present with things like diarrhea, which is not classic with the flu. Um, but it is a very kind of subtle difference. So, not anything that I would tell my patients, if you have this, I can guarantee you don't have the flu. In reality, COVID is a very interesting virus because it presents in lots of different ways and lots of different
Yeah.
people. Since I've been doing so much testing, I can tell you that I have stopped being able to predict or
Yeah.
thinking that I'm able to predict who is going to have a positive test and not. It surprises me all the time.
Yeah.
So
Wow.
yeah, the reality is we're going to have, people come in who have a cough, cold-like, flu-like illness, and we're going to have
Yeah.
to check.
Yeah. Wow. So, I guess it's good that we have the flu vaccine, obviously. It's kind of a bummer that we can't really differentiate between the two, COVID-19 and the flu.
Without it.
But I definitely want to encourage people, if they are experiencing symptoms, that they can reach out to Whitman-Walker, because we are doing symptomatic testing. So,
Yes.
um, want to throw that out there. So, everyone's probably wondering, when do we predict the pandemic will end? And, like, is that soon? And, I know that conversation really, I guess, like the conversation comes on the back of the idea of a vaccine for COVID-19. And so have we heard anything, how important is this vaccine?
Yeah. So that is the $1 million question, right? Like, I think there's been lots of different things that have been said. I think I am probably more in the camp, and lots of scientists are more in the camp of what we've heard from Dr. Fauci and NIH, is that we've got lots of great vaccine candidates that are being studied right now. It is not just the hurdle of getting a vaccine that works. We also need to be able to administer it to enough people to then
Yeah.
create enough immunity in our country. So in reality, that's probably going to take until sometime later next year. So I know there's been a lot of hope and some
Yeah.
discussion of the vaccine being approved in October. Um, that may or may not happen. But again, approval is kind of the first step. And then we need to figure out how to get it out to everyone, give it to enough people, and have enough time to have it work. So we're in this for a long haul. But the
Yeah.
good is we do have things that help prevent the spread. All those things we've gone over: hand washing, mask wearing, staying home when you're sick, maintaining distance. But we are in this kind of new reality for, at least another probably 9 to 12 months. And
Got it. Yeah. I mean, wow. That is also a bummer, but it is good to see that, more information is becoming available. We
yeah,
have more resources to at least, manage the pandemic a little better. So, that's good. Speaking of like managing COVID-19, what is Whitman-Walker doing to respond to COVID-19? Are services opening back up? Are we, closing things? What's happening?
Yeah, that's a great question. So we did a lot of kind of reconfiguring the way that our clinics flow to keep staff and patients and clients safe. So what we ended up doing is before we opened back up services, and I can kind of go through the list of services we have, we made sure that our exam rooms were set up with HIPAA or HEPA air filters.
Oh, that's great. Yeah.
Yeah, that we set up enough staff in order to keep everybody distance. We still have people working from home, but we have a crew that comes in and works in the clinic. And we have opened primary care 5 days at both of our sites. We are still doing asymptomatic COVID testing. We do that in the afternoons at 15:25. We don't do it in Anacostia because our clinic is literally right across the street from a city testing site. So
Okay.
we are able to kind of refer patients right across the
Right
street
across the
or
street.
do it's testing if they need it for like a surgery or to go visit grandma. We can do that appointment. And then in the afternoons, if people are having symptoms of coronavirus, we ask that they come in at a special blocked off time in the afternoon so they're not around people who aren't sick, and we can do, testing, either a rapid test or the send out test, depending on the situation. We also are testing. So we're doing HIV and STI testing. We are having our sexual health clinic. So that's happening at Liz, which is on 14th Street. We are also open for, so far, and probably Randy will go into this, still telehealth or telemedicine for behavioral health. Our addiction services are open again. So we are taking people who are looking to get into addiction services, especially medication treatment. So anyone who needs any substance use disorder treatment, they can come in and be seen. So we have opened kind of the majority of our services, new HIV care, PEP, so post-exposure prophylaxis, PrEP, pre-exposure
Mm-hmm.
prophylaxis. Those are all available. Um,
Mm-hmm.
I think Jewel put up making sure you call ahead because we are asking that people call ahead so we can plan for someone to come into the clinic. We are
Mm-hmm.
walk-ins right now.
Yeah, absolutely. And I'm a patient of the prep clinic. And so I definitely know that, it's still happening. You can go and get your prep or PEP if that's what you need.
Yeah.
If you have a provider at Whitman-Walker, you can email them.
Yep.
You can use the telehealth services, but there are ways to manage during this time. So we're here to help. I don't see any questions in the comments, but do you have anything you want to add to the conversation before we, pass it on?
I would say, and this is maybe a segue into what Randy's going to talk about with kind of dealing with coronavirus,
Yeah.
but hopeful because I think people have started to become creative with how to deal with this virus because we are in this for, like I said, the long haul, but we have figured out how to make outdoor dining work. I think there's already talk about having heating lamps and blankets available,
Yeah.
5 minutes, and, Zoom meetings and Zoom happy hours. So I
Yeah.
think it has allowed for creativity and maintaining connection, and that is really,
Yeah.
really important because that isolation, depression, all of those types of things not only lead to mental health issues, but it spills over into physical health issues.
Mhm.
So I think kind of really focusing on how to maintain our connection with each other, even if it is at a distance, is really going to be important.
Absolutely. So thank you today for joining us. We appreciate all the information. Yeah, and thanks again. I hope we get to do this. Well, I kind of hope we get to do this again, but not too many times, right?
Maybe we'll be that the vaccine is here and how to get.
Yeah. All right. Thanks for joining.
Yeah, thanks for having me.
All right. Bye bye.
Bye.
All right. And so next we'll be joined by Dr. Pumphrey. Once we get him on, y'all allow him to introduce himself, and we will take it from there. Again, if you have any questions, feel free to drop them in the comment box, and we will do our best to answer those while we're here on live. Bear with me as I get Dr. Bumphrey in here. Let's see if I could do this. Wait. Oh, got it. All right. So while we're waiting for the doctor to join, um, for those of you who are just joining me, again, I want to reintroduce myself. I'm David Wilson. I'm a Whitman-Walker influencer. And today we are talking about or answering questions about COVID-19. So we just have Dr. Pumphrey, who just joined us
Hi there.
on the call or live.
Hi.
How are you?
I'm good. How are you?
I am good. So I'll let you introduce yourself.
Sure. My name's Randy Pumphrey. I'm the Senior Director of Behavioral Health at Whitman-Walker. And on and off, I've been at Whitman-Walker for probably almost 20 years in different relationships here.
Yeah, that's a good amount of time.
Yeah.
So the last time we spoke in March, when everything first shut down, and obviously stress levels were also high at that time.
Right.
How have you seen the pandemic affect people's mental health since then?
Yeah, it's as Colleen was saying, it's a really important question. We're watching people's physical health, but their mental health was something that we saw really go through stages. Initially, it was sort of shock. I just remember my own staff having to pivot to telehealth, and suddenly they were having to learn virtual platforms, learning how to adjust to helping their clients learn virtual platforms. They were working from home with their pets and their kids and their partners and all the stuff that happens. I remember one of my therapists actually doing therapy from her bathroom, sitting on her toilet because her pets kept disturbing her sessions. So
Yeah.
we had to be really creative to continue to do this. But we really did. We really did our best to try to meet our clients' needs. So the first thing was just this really big shift in culture. Everybody staying home, nobody being out on the streets. I just remember coming into Whitman-Walker and it was dead. And what a difference it felt from being on 14th Street, which is normally really bustling and lots of people always around, to being kind of a desolate place.
Yeah.
And then I saw my clients, particularly some of them, become more depressed and anxious. And it really depended on whether they had a social circle, whether they lived alone or with somebody else. And even if they lived with somebody else, that became complex also, because suddenly roommates were having to stay together, or partners were having to work together, or people had to share, they had to suddenly be a parent and a teacher and a worker all at the same time. It was really hard for many of my clients who were long-term survivors of HIV. And I have in my own caseload a lot of those. And it was hard because they were so scared going through one pandemic that suddenly with HIV, and all of them had really chronic underlying issues, that they were afraid to leave their homes. And one of my clients, he didn't leave his home for 4 months. Friends brought food to him because he was so afraid to leave.
Wow.
And I think that was just one of the examples of, people just being afraid of what was going to happen and not wanting to die. These were women and men who had lived through HIV, when all their friends died, and now suddenly they were living through this new pandemic. It was also really hard because especially for our clients who were in substance use, when we switched to a virtual platform, they had learned that they needed each other in 12-step recovery groups or being in group process. And it did take us like 2 weeks to be able to get the group process up and going. And in that time period, that adjustment of just not having immediate contact with people, a lot of folks relapsed. And we had to work hard to try to bring them back into care and to help get their lives stabilized again.
Yeah.
Now, there was one other group that I saw, and that was really interesting. And this were initially people who tended to isolate. anyhow, or withdraw from culture because of some depression,
Yeah.
they almost seem to thrive a little bit because suddenly the norm was to be by yourself, to be alone. So suddenly there wasn't any cultural expectation for them to sort of be out and about. And there was like a relief. And it was interesting for me as a mental health provider to suddenly see people who I had known historically to really struggle to suddenly do better. And then as things started to open up, then their symptoms came back.
Back, yeah.
Yeah, because it was like now the social world was anxious again because they were afraid, people are now moving around. I could possibly get sick.
Yeah, wow.
I think you mentioned it with Dr. Lane earlier, the longevity of this, now that we're in the 7th month of like Washington, D.C. dealing with it, it's people are starting to try to figure out how this is a new normal, but resisting it. They don't want this to be the new normal. We want to get back to a life where we can connect.
Yes, absolutely.
Yeah.
So, what are some tips that you have for taking care of your mental health, in the short term, especially when you're dealing with acute stress?
Sure. So there's so many things that come to mind for me. But one of the things I think is really critical to remember is when somebody's in the middle of acute stress, it's really hard for them sometimes to remember to do things that are good for them. So, everybody talks about these are the things that you should do, make sure you're getting rest, make sure you're eating right, practice mindfulness, meditation, prayer, stay connected to others, but use safe formats, as Dr. Lane was saying, distancing, using FaceTime, Zoom, some social media, and get exercise. But, we all know that we have succeeded and failed in this. Because when you're in an acute stress situation and you're dealing with a reality that you think, this might not be short term, what's my coping mechanism? And I think there's actually a phase that I'm watching where people are now, because this has gone long enough, they're now readjusting their behavior. Like some people said, okay, some people got in really good shape. They really exercised. They did.
I wish I was one of those people.
I know they did all of those things. And now it's like there's people who are waking up and going, wait a minute, maybe I need to use this time differently in my life. Maybe this is an opportunity. There's a playground not far from Whitman-Walker, and every morning when I park or ride my bike to get to work, everybody's working out in this playground of the school. And I think that's really admirable. These people, they inspire me.
Yeah, I wish I was one of those people.
I haven't been, so that's my confession.
Yeah, same. I'm more of a routine person, so since my routine is completely changed, I just can't fall into place anymore.
Well, somebody said just today, when I would wait, I had a ritual every morning that got me from bed to work. And that ritual really helped me. And my drive to work or my commute to work really helped me kind of reset that I was now this person. And he said, I don't have that. And so I feel lost. Like it takes me a lot more time to adjust from how do I go from my bedroom to my living room where I now work?
Yeah, no, seriously. I mean, it's I can relate to that because I literally finished up work and they had to jump on this call. And I'm it really wasn't a real transition. You used to having that space where you transition into that next part of your day, and that's not happening anymore.
Right. And I really appreciated being able to come into Whitman-Walker and work out of the Liz building. It's been really my lifesaver because now I get work at home a couple days, and it's really difficult. That transition is really difficult.
Absolutely. So you gave us some tips about how to manage stress in the short term. What can we do to help manage our mental health in the long term, especially since we think COVID is going to be around for a while?
Yeah. So I think there's 2 parts to that question, and one of the parts is that it's we're heading into the winter months, and I don't know about everybody who's maybe watching, but I feel like I went to sleep in March and now it's suddenly October and I don't know where those months went. I mean, they just breeze by and I go, it's the fall now? Wait. What happened? What happened to the summer? It left.
Yeah.
But the winter months are always hard because as the days get shorter and the light is less, people tend to get more depressed anyhow. And also they tend to be inside more. So what we have to know is we have to think about how we're going to take care of ourselves and watch out for things like increased depression, increased anxiety that might be uh, for symptoms like suddenly I'm not sleeping well or I'm sleeping too much. I'm not eating or I'm withdrawing from friends and family. As one person said to me, I'm so exhausted by Zoom and I'm so detached from real human contact. Like I just need to touch somebody, like
Oh,
have a
yeah.
hug. And human beings need that. And so when we don't have that safe space, it's really hard. So what I think is, you know, do whatever you can to take care of yourself. The one thing that's really pretty cool, and I know people are exhausted by Zoom, but especially for persons who are in recovery, um, all of the recovery groups have gone to Zoom or online platforms, which means I can go to a 12-step group, like an AA group or an NA group or an SCA group. I can go to one in Washington, D.C., but as many of my clients are doing now, or I can go to one in New York City, or I can go to one in California, or I can go to
Yeah.
one in, there's one guy who goes to a morning meeting here every morning, and there's a guy from Australia who's in the meeting.
I
And
love
so,
that. You get
yeah,
a little
so it's
world
one
tour
of the things
going.
that we didn't predict that
Yeah.
suddenly you could suddenly develop these like cross nation bonds with people in recovery. The same thing goes for depression support groups or even any of the other kind of virtual spaces. We have lots of peer support groups here at Whitman-Walker, and people should check them out online and see if one might fit their needs. So we have to do something. The other thing is we talked about mindfulness. I always say if you're part of a spiritual or faith community, you might want to explore that. That too is online. And slowly as things begin to emerge, and Dr. Lane pointed this out, whether it's spending time with people in outdoor spaces or being in real time where you can be together and safe is critically important.
Yeah. And so, speaking of being with, people we care about, our loved ones, how can we support, those folks who might be feeling anxious or depressed?
Yeah. So first and foremost is engage. If you suspect somebody's depressed or not doing well, lean in. So often people will pull away or they're afraid to say something. But I always say, be the first one to check in. Are you okay? Something's not right.
Hmm.
Can I help? Do you want to talk? Um, and if they're not in a good place, there are certain things you can do. One is refer to a hotline. There's so many hotlines out there, and I have clients who see me, but if they're in a critical place in the middle of the night, they'll call a hotline and talk to a hotline worker who's trained to help them. And it means that they don't have to kind of feel like they're burdening a friend or burdening a family member. And it may be exactly the recheck in that they need from somebody who they can really feel comfortable talking to. Um, I also think, as I said earlier, spending time with somebody, so if you realize that somebody is kind of getting depressed or becoming detached, invite them out for a walk.
Yeah.
Get outside and have a conversation. I just recently realized in my own life, I was like really getting kind of detached. And I thought, I just have to connect with one of my best friends. And she and I sat on her porch and we were 12 feet away from each other and it was outdoors and we were able to like take off the mask and feel safe.
Hmm.
And that felt good. We protected each other until we were in a place where we could be safe, and then we could spend 2 hours talking. And that was a wonderful thing to do. Um, Also, the other thing I think we have to remember or be mindful of is, when you think about over 200,000 Americans have died, I mean, every one of those people have been connected to another group of people. And those people are grieving. And there's so much grief right now in our world, not only because of COVID, but because of racial injustice, because of all the strife that we're feeling, that it's really having the courage to lean into the sadness. I know that in the early days of HIV, one of the things that was really important for me, and it's still important in the work I do today, was not to lean away from it, but to lean into it. That really makes a change.
Absolutely. Right. Thanks for sharing all that. That's great information. I happen to live alone, but I know, a few folks who actually live with other people. So what are some suggestions for fostering, a healthy living environment for those people? What would you offer?
Yeah. Number one, negotiate space. Depending on how big the space you live in. I know that doing many Zoom meetings here at Whitman-Walker with staff, I will often see people who live together like they might be a family, or they just may be a family of choice, meaning friends who share a home. Mm-hmm. And you see, as you look through like rooms, you see different people have negotiated which space is theirs in order to do this work that they have to do. So we're working together and working in our homes. So it's really negotiate the space, figure out what space works best and how it's going to work. Then find time to do something that makes you happy. We all have, it's different for each one of us. So I might like to watch movies. Somebody else might like to go play tennis. I mean, do something that makes you happy. I
recently downloaded a karaoke app.
Yeah, there you go. Sing. That's
really
great.
Enjoy it.
That's perfect. Sing, dance, do whatever. It's great. It's great. I have a 92-year-old mom who lives with me, and she has Alexa play songs, and she sings them with her. It's the same thing. And I'm like, is she singing? And she is, and she's enjoying herself because she can't get out. She's like, exactly. I'm 92 years old. I have to stay in the house. Try to separate work and your home as much as possible. I mean, as we talked about, that transition or ritual of going to work, try to figure out a way to make that ritual happen at home, where there's a place where you start your day and there's a place where you end your day, and you figure out what that looks like for you. I know that for many of my clients who are in, relationships or have families, one of the things is how they spend time together. So really making an effort to spend time together in an intentional way, be patient with each other, and really understand that compassion and empathy are really greatly needed at this time, because folks have a short fuse. We're all a bit burnt out by this. And so if we can kind of also lean into compassion and try to find I get it, we're all in this together, and actually name it. I think that too many times we try to push it down and ignore that it's happening. One of the things I love about coming sometimes into Liz is, we will all say, somebody will shout, it's a pandemic, like we have to wake up and remember that nothing is really normal, even if we want to pretend like it's back to there. We're not back to normal yet.
No, exactly. All right. And so, you mentioned being at, the Liz, and tell us, how is Whitman-Walker responding, from a mental health perspective? How are we responding to, that toll on people? How are we helping people access services? Maybe you can inform us a bit about that.
Sure. So, one of the pieces to the work of going into telehealth really fast was something that we had always envisioned doing anyway. And so in some ways, COVID-19 gave us an opportunity to have to pivot really quickly into this. And I was really very proud of our behavioral health staff, the psychiatrists, the psychotherapists, our peer counselors, who did a lot of work to understand these new platforms and to engage their clients in order to be able to do the same thing. And one of the things that we found is that, very quickly we started seeing more clients than we had seen before. And that's because, clients didn't get stuck in Metro or they didn't get stuck at home, and we could go into their home virtually and have a session with them. And that was really good. We also needed to respond really quickly to people who are in need. So we've taken a lot of new clients into our care. Some of the things to know is that we still provide individual and group psychotherapy. We provide psychiatry. But I need to just do a reminder that because of the clients that were referred from our medical providers, that we really desperately try to see to make sure they have complete care, that a person who wants behavioral health care, meaning mental health or psychiatry, needs to be a medical client of Whitman-Walker Health. Now, the other piece to that is our substance use disorder treatment, and Dr. Lane talked a little bit about that. Not required to be a medical client of Whitman-Walker in order to access those services. So we can assess you, our psychotherapists who work with addiction or substance use disorder, as we call it now, can talk to you and help you decide whether this is the right place or maybe you need a different kind of care or like a higher level of care than Whitman-Walker can provide. And last but not least is our peer support. So we have a great peer support coordinator, Michael Mitchell, and he helps facilitate and run. And we have a whole group of peer counselors who do groups and individual. So hopefully through one of those means, we can give you some assistance.
Absolutely. All right. Well, that concludes the questions I have for you. Is there anything else you would like to share with our audience?
The only thing I would like to just remind, I think it's really important for all of us.
Oh, did I lose you? I might have lost Dr. Pumphrey. Let's see if we get him back. Well, looks like we lost Dr. Pumphrey. Sorry about that. But that was at the end of our discussion anyways today. So I want to thank him and Dr. Lane for joining us today. But most importantly, I want to remind everybody that social distancing is still important. It's a way to reduce the amount of COVID-19 community transmissions. And so by deliberately increasing that physical space between each other, we help avoid spreading this illness. So social distancing, it involves staying 6 feet away from other people when possible, wearing a mask in public, avoiding places, especially places with large crowds, encouraging people to work from home if that's possible. If you have family members that you want to stay connected with, try to do that over Zoom or FaceTime or do phone calls. In fact, increase that amount of contact during this time, because people need to hear from you more now than they ever have. Even if you don't think you're at, risk, social distancing helps prevent, the transmission of COVID-19 to people who may be at a higher risk. So think about our older population, our grandparents, our older family and friends. Those are the people we want to help protect. So also think about the fact that people may not have any symptoms for 2 to 14 days and can still be able to pass it on to someone else. Also, we have people who don't have symptoms at all and could actually still transmit it. So I want you all to keep all of this in mind, when we're out and about and we're, continuing to live our lives, we have to, but make sure that you practice social distancing. Also, you can visit whitmanwalker.org/distancing care for support if you need that help navigating social distancing, and if you need help refraining from social distancing is caring for your community. So make sure that you continue to social distance. We all know that these are stressful times. Whitman-Walker Health is continuously here to help you. We are here for our community. Be kind to one another as well as, just be nice, be caring, be there for one another. And we will get through this together. We definitely will. So thank you all for tuning in again today. Don't forget to follow us on social media at Whitman-Walker. That's on Twitter, Instagram, Facebook. You can follow me, Sir_Dave_ on all of those platforms as well. And I look forward to giving you more information soon. So thank you. Hope you all have a great Tuesday.